So I joined the Young Advisory Council because I felt like young people needed a voice in the direction of healthcare moving forward.
When I heard about the fact that they were putting it together, I got excited because I thought that it would be a way to both give back in the form of input and volunteerism, but also create or have a unique opportunity to learn more about how healthcare is impacting our generation.
We want people from various professional and personal backgrounds because we know that they carry their voices and their perspectives with them when they come join us at the table. And so we know that diversity in thought is what's going to lead us to building innovative solutions within UnityPoint Health Des Moines.
If they want to help move us forward as a city, joining the Young Advisory Council would help that, because the input that you provide goes directly into the board of UnityPoint and helps move that organization forward as well.
The hospital has given us a chance to have a lot of autonomy and really listen to us and allow us to just think freely.
This has been beneficial to me personally, because I've been able to step back and think about the way that I've led before and look at my peers that are on the group that are extremely well qualified and leaders in their own right, and understand how they're doing it, and then try to use some of their practices back in what I'm doing.
I would say it's given me an opportunity to network with people across other professions and other young professionals, and also allowed me to think about things in a different light, allowed me to bring some of my expertise and my perspective to UnityPoint.
I'm very surprised by the depth of information that we get in these meetings, and then also the ability to provide feedback in a meaningful way that we know gets trickled up to the people that are making the decisions in the boardroom.
Initially, there wasn't a lot of structure around what our purpose, and they allowed us to create our own purpose and allowed us to kind of forge our own direction, and they provided to us very loose guidelines and allowed us to fill in the gaps.
What surprised me the most is not really about the group itself, but about UnityPoint Health Des Moines. I think the size of the organization, the way it runs, the intentionality that they have with everything, that's what most surprised me, I think.
Just wanting to provide perspective. I think that we have robust discussions, and it creates a like a sense of unity amongst a group of young professionals that otherwise wouldn't have come together.
This group is unique because we are the one and only within a healthcare setting in Central Iowa. This is the one young professionals advisory group in Central Iowa that's able to touch on healthcare topics and discuss how we can better meet the community's needs when it comes to receiving healthcare services.
I think these are some of the big up-and-comers in Des Moines, so it's awesome just to put a face to a name for the most part, because I think you hear about a lot of people in that room, but you don't actually get to meet them.
The meetings typically comprise of an education session where, and those are typically determined by the YC members and which area of interest they have. And so a leader from that department will come with a presentation on that topic and really share what the purpose of that department is, what impact they have on patient care, and what feedback they're looking for from this young professional demographic on how they can provide better services and meet the community's needs.